Hello, everyone. It's July the 8th, Wednesday. Let me take you back just for a second to a day way back in early March, I believe, maybe even late February. I read these words to you at that time. It's not time to panic. It's time to be cautious. It's not time to be fearful. It's time to be smart. It's not time to be weak. It's time to be West Virginia strong. Now, if there's any time along those same times that we need to be just that, it's today. You know, today, very happily, I tell you that we do not have another death that has occurred since Monday. We have 95 total deaths in the state of West Virginia, and it's always 95 too many. We have now tested 192,849 West Virginians. Yesterday, in the United States of America, we had 60,209 positive cases, a record for 24 hours. We see what's going on all across our southern states, and we see in the state of West Virginia that yesterday we had 147 new positive cases. We had a daily rate yesterday, and remember, we want to try to keep this significantly below 3, but we've managed to keep it under 2. We have had many days that we have had it at less than 0.5% in a day. Yesterday, our daily rate was above 5%. Now, that's not good. That's not good at all. Mon County has 202 active cases in that county right now, and that's not good. This is an increase of 62 active cases in the last 24 hours. Now, what do we do? What do we do? We absolutely have got to be as strong as we possibly can about wearing our mask or our face coverings in any public building. When you leave your house, if you're outdoors and everything, there's no worry. West Virginia has so much the ability to social distance in West Virginia, you know, that's not the worry. The worry is when you go into a Walmart or when you go into an Applebee's to eat dinner, wear your mask. Take your mask off and eat. Put your mask on if you go to the bathroom. Put your mask on when you leave the building. Absolutely, we have got to have you do that, and we've got to move and have you do that right now. On Monday, I put out an executive order to just do exactly that. Now, I entrust West Virginians can handle that and handle that from the standpoint of being on an honor system. Now, if you can't, we'll have to move and make that more stringent from the standpoint that we'll have to assess some level of penalties for your non-compliance in not wearing those masks. We have got to have you know that it is an executive order from the governor that masks are mandatory in public buildings, and absolutely, please, West Virginia, please, let's do this. There is an absolute whiplash of this terrible killer that's moving across our land, and it's moving rapidly. We do not want that terrible killer right in our back door. There may very well be a point in time when we have to treat this on a county by county or in a regional assessment from West Virginia differently than a statewide assessment. However, you know, you can stop it, West Virginia, and if you'll just absolutely try with all in you to protect yourself and protect others. Love your neighbor, just like absolutely that we should be always doing. We'll be okay. It is something that we should be very concerned about as we move forward. It is an absolute requirement now and mandatory of anybody that is above the age of 9 that you wear masks and everything in public buildings and in all situations of public buildings. Please do exactly that. Now, I want to talk to you about schools. And I've got, our head guy here with us today, Clayton Birch. And Clayton is our statewide superintendent. And Clayton will be available for questions. And I'm sure that we'll get questions in regard to this. But think about what is going on in our nation today. Our president is urging all of us to go back to school. Nobody wants us to go back to school more than I, or more than our superintendent, Clayton Birch. Nobody wants that. But I can tell you just this, that we absolutely, totally are ready to go back to school today. We have plans in place, and the superintendents in the counties have done fabulous work, as well as all the people that are working on the safest and best ways for our kids to go back to school. But the other thing is just this, it's just this simple. From my standpoint, it doesn't matter to me. I love our president, and I love all the great stuff that he's doing, and I hope and pray to God above that he'll be reelected and we'll continue on the path that we're continuing on. But in this situation here, I've got to look out first and foremost for the kids, the teachers, the service personnel, all those that are involved, from right on down to the parents and everybody else that are involved with our kids. And I'm going to do, at the end of the day, what I think is the most safe thing and best thing for our kids. Everyone has got to realize this situation is a moving target like you can't imagine. As we continue to formulate plans and adjust those plans as we go, that will be our best alternatives in any situation. I don't care what game you'd be in or whatever contest or what any situation you'd be in, we would make the best decision in a business decision or whatever it may be with the more information and the longer we could delay having to make that decision. The reality is really simple. With this today, we do not know the level of exposure today that we would be putting our kids, our teachers, our service personnel, and on in today. And absolutely with that, I can assure you beyond any doubt that I am not going to move until I am absolutely as sure as I can possibly be that our kids are going to be safe. That our absolute teachers and service personnel and our parents are going to be safe. Now we know, we get it here. We get it completely. The ramifications of not going back to school are horrible. Absolutely horrible. So what do we do? What do we do? We do exactly what I have been taught to do all along. And that is just this. If you don't know which way to turn because you're absolutely still bringing in more and more and more information, you don't jump to your left or jump to your right or jump behind you, especially if there's a rattlesnake that's 10 feet away and you really know that there's a possibility that there could be another one over here because this one out here is not going to hurt you. What do? You stand still. You look to your left, you look to your right, and you look behind you, and then you plot a course that is the very best course for all of us to go. Now, with that being said, Superintendent Birch and all the people that we've been meeting with over and over and over believe that they have a methodology that we could go now if absolutely need be. But in all of that, the more information we have and the longer that we can push this out, the better off we'll all be. And from that standpoint, it is preposterous to think that we can be going back to school, in 2 or 3 weeks with the information that we have right here. I mean, to go back to school in 2 or 3 weeks with absolutely an avalanche of situations that we have, our cases exploding to the upside, absolutely, if we were to rush this and go back to school in 2 or 3 weeks, in my opinion, it's the wrong decision because we don't know. We just don't know what's going to happen. We have to buy some time. And so what I'm doing today is I am now trying to just move us back. But with the great work of, our Superintendent Birch and all those people that are around him, now what I am going to do is tell you that we're going to target a start date of September the 8th of all of our counties. We've looked at calendars from September the 8th and still being able to get out by the end of May and be able to condense the schedule and pull that off, and we absolutely feel confident that we can do that. Now, in regard to sports and everything, if we could move the start date and push the start date back of our high school football or our fall sports and everything to the Friday before, or maybe even the possibility of the Friday before, and that we'll let you know about, and we'll let you know more about that on Friday, of this week. But right now, from your governor's standpoint, being able to protect and assure us absolute assurance to the very best that I can give you of us being safe to the highest level that we can be for our kids and our teachers and our service personnel, we need that calendar date, their start date, to move back as far as we can and still be able to accomplish everything with as much normalcy as we can possibly do. So that's what we're going to do. We're going to move the start date to September the 8th, and we're going to work with the SSAC as far as our sports and our fall sports, and that's where, I'm surely will welcome your questions, and Superintendent Birch is here today, and he'll be able to add to those questions with a lot more expertise maybe than I. As far as our outbreaks, I've told you about this. Myrtle Beach continues to be a horrendous problem. Now we have 140 cases that have come from Myrtle Beach. I would strongly urge you, if you have not been tested and you have been at Myrtle Beach, to please be tested. We need those results, and in order to be able to protect us, we need to continue right down that path. We're going to have free testing in Mercer, Marshall, Mon, Preston, Upshur, and Wayne counties on the 10th and the 11th of this month. Again, we want especially our minorities to come out and be tested, but all of those that have any concerns that want to come out and be tested, please come and do that. In regard to our grants, we have now sent out $32 million plus to, on 141 grants to our cities and our counties. I want to just say this, I am in receipt of a letter now from our cities and our counties and that basically are saying, why put any money over in the roadside? We can use more money to our cities and our counties. And I would just say just this. As we continue to go forward, we have additional dollars in the CARES lineup and everything to be able to move additional dollars over to our cities and counties if we see that those cities and counties can qualify for more dollars. We want more dollars coming to our cities and counties. Now, we don't need to get a letter in regard to how to do that and everything, because really at the end of the day, I think we can put these monies over into our highways and fix a lot of our highways and do a lot of great work that we need to do to our highways in West Virginia that we're not going to be able to get to if we don't do this. And absolutely, legitimately, we have vetted it and vetted it and vetted it. Now, where does that leave us? It leaves us just here. Our revenue people forecast and give me numbers. I don't make them up. They give me numbers. And based on their best forecast, the $200 million that we have slotted over there is the number that the counties and the cities will be able to qualify for. Now, if in fact there's dollars that they will qualify for in excess of that, you've got all kinds of potential buckets, that will happen right behind that. These dollars are not for revenue replacement. These dollars to the cities and counties are dollars that they qualify with under the guidelines that we have to go by today. But just think, and this is to the cities and the counties, just think, absolutely in the month of July that we're in right now, I truly believe that there will be additional stimulus come. That additional stimulus may very well come and change the Fed's guidelines that will absolutely be able to pump even more money to the cities and counties. If that doesn't come, remember, there's $678 million that we've set aside to absolutely be sure that we prop up the unemployment fund to where we don't have to raise taxes on our businesses and just absolutely drive more and more out of this state, and that's sitting there. We all believe that a portion, if not all of that, is going to be forgiven. And if that be the case, then you've got another $678 million that's sitting in the wings that could be used if, in fact, federal guidelines are changed and no more stimulus dollars come, that could be used for our cities and counties. You see, there's a real methodology to what we've done. And at the end of the day, really and truly, we can fix our roads, and we absolutely will have dollars for the cities and counties if, in fact, they are able to qualify for in excess of $200 million. And I hope to goodness that they can. And from the standpoint of additional stimulus, you can bet it's on the way. Everything that I've told you that will come to pass has come to pass. And absolutely, I believe that there'll be another stimulus level, and absolutely, I believe that we'll be able to pump more and more money into this great state as we go forward in each and every way. Now, the biggest concerns that I have today are our schools. How are we going to get our kids back in school? How are we going to do that? How are we going to do that safely? And how are we going to do that from the standpoint that our kids need to be in school? They've got to get in school. There are studies out there that say that kids that are from, in the preschool or preschool through or K through the sixth grade, that those kids don't get this disease. And not only do those kids not get this disease, they don't transmit this disease. And then day after tomorrow or a week later, someone comes out and says, hold on, wait a minute. That's not exactly true. We have more concern. And so if you're me, if you're Clayton Birch, if you're all these superintendents, if you're all these kids and the parents of these kids, rest assured that all of us are working night and day to try to continue to watch the fluid change and make the very best decision we can make. If we can buy ourselves more time, the better off we'll be. That's exactly what we're doing. We have a summer feeding map that's coming up right now. 690 sites. We're getting people fed all over the state, and we want you to continue to know that you can call 211 if you need assistance in being able to figure out where to go and what food to get. From the standpoint of our census, beware that we're running out of time. We've got to be counted. We're running behind the national level, and we've got to get ourselves counted. Last thing I'd tell you this is I've been very, very proud of being able to show you our graphs. And if we could put those up on the screen. Now just look what's happening. Look at the active and the recovered cases that are over at the top level here. Now, are they moving apart like they were, or are they moving closer together? And you can see the top line is turning down, the bottom line has turned up significantly. They're not moving the way we want them to move. Look at your positive daily cases right down here, the second line. Do you see the way we're moving there? Do you see that the problem there is just this? You see that spike back there? That spike was Huttonsville. Well, we don't have a Huttonsville now. We now have community spread. This over to the right-hand side that's spiking and moving in a direction that we don't want it to move at all is community spread. Now that's bad. That's not good. Now if you look down at the bottom, this is our total positive cumulative cases. Look the way it's moving. That's why we've got to wear a mask. I don't like these masks. I don't like them. They're inconvenient and everything else. But unless we're going to go and move and be faced with having to shut things down, shut down our restaurants, our bars, shut down different things across our state again, we've got to do this. Now look, I wish to goodness that I had all kinds of bullets in the gun. This is one of the only bullets that I've got right now other than having to shut things down. This is the only bullet that I've got. We have got to wear our mask. That's all there is to it. Right now, West Virginia, this is the only bullet that I have to stop this and to protect you and keep you safe. We'll come up with a sterling plan for our schools, the very, very best that we could possibly come up with. We already have great work and great plans that if we had to go tomorrow, but West Virginia, do you really, really think with what's going on here with the graphs, and put them back up one more time, Jordan. Do you really think, West Virginia, in looking at what's going on right here, do you really think that we can be back in school in 2 or 3 weeks? Do you really think, in looking at that right there, that that would be the smart money for us to do in 2 or 3 weeks? It's not. We need to buy ourselves some time to make absolutely the best move that we can possibly make. Irregardless of any level of outside pressure or whatever it may be, I'm going to listen to the experts and I'm going to make the very best decision for our kids in West Virginia and our teachers and our service personnel and the parents and right on down the line that I can make. And that's what I'm going to do. So that's all I've got today.
All right, thank you, Governor. Let's first go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. I'd like to make my comments focus first on our national situation and then on our state situation. So as the governor said, we have passed a milestone with 3 million people in the U.S. now being infected with the coronavirus. We talked about this surge. We talked about the rate of spread and this compounding effect, this logarithmic effect. When more and more people get infected, it starts to accelerate the infection rates and times. And just sort of see this in the following information that I want to share with you. So it took 99 days for 1 million Americans to be infected with COVID-19. It then took 43 more days for 2 million people to be infected nationally with COVID-19. And now in 28 days, we have 3 million people infected with COVID-19. And as people have talked about, then we see that there is a reducing age in the average person that's being diagnosed today. And so we know today the average person in the states the governors talked about, Texas, Florida, Georgia, South Carolina, Arizona, California, is now down below 50 years old. And in some states like Florida, it's below 30, 35 years old. And we have this false understanding or belief that if younger people get infected, that somehow it's okay, that they don't really get sick. But in fact, if we look at these states that are having the most positive cases, like for instance, Texas that had 10,000 positive cases yesterday, or Florida that had 8,000 positive cases yesterday, they are running out of hospital beds, they're running out of intensive care unit beds, and they are running out of ventilators in many places. And while we still see people that are older having the most severe problems on a statistical basis with this disease, we also know that these hospitals, these ICUs, these ventilators are also being used for people that are 20 years old, 30 years old, 40 years old. And people 20, 30, 40 years old are dying of complications of COVID-19, or they're being affected for the rest of their life with strokes, with heart attacks, with amputations because they're clotting the blood in their legs and their arms. So this is a terrible disease, and we can't forget that nobody is immune from having this problem. And way back when we first started this, we were aware of the fact that the likely real mortality rate, if you look across everybody and you're able to maintain the function of your hospitals and ICUs, is probably in the range of 1.5%. Now, nationally, we've seen COVID be the mortality rate here in the country be as high as 5.5%. Now it's 4%. So when we see some of the death rates reducing, we can then start to understand that because we're testing more broadly and younger people are being identified and perhaps being infected quicker, then some of that mortality information is coming back down to where we knew probably it always has been. But we also know when you overwhelm your healthcare systems, your ICUs, that death rate goes from about 1.5% to about 5%. And in some countries, more like 10 to 13%. So we have a very vulnerable state. And what we have said to you and said to the governor, that we are going to follow key metrics, key mathematical statistics that we're going to be able to use to then give the governor the insight to where we see this starting to really build and go into that logarithmic, that compounding effect in West Virginia. And we're seeing that now. So yesterday, West Virginia had the third highest RT or R naught value in the country based on the RT Live website. And today we have the fourth highest. So our RT value today is 1.29. And as we've said, every time the RT value is over 1, that means that COVID is spreading and growing. And we've seen our RT value go all the way from 0.6, meaning we had it under good control, to now almost 1.3, which says that it's really spreading broadly. And to support that concern, the governor just shared with you that we see now the number of tests that we're doing, the number of people that are turning positive, that percentage is going significantly up. It was below 1% and then 2%. And over the last 5 to 7 days, we've seen it consistently over 3% and now as high as 5%. And at the same time, we've seen our cumulative number rise, which means that we've had a lot of activity. And as the governor said, this is community-based spread. This is real spread in West Virginia, where all of us now, even people not in those congregate settings like nursing homes or correctional facilities, we all are at risk for developing this, and we all need to work together to slow this down. And to support that, although our ICU use is not up yet and our ventilator use is not up yet, our number of people in the hospital with COVID is starting to go up. So that's the third metric that we're using. So I think the governor has been very appropriately concerned and conscientious. And so right now is the time to start to enforce these mitigation measures. And masks, we know, as we've talked about before, states that have these kind of mask laws have seen an 11 to 12% reduction in their COVID cases versus states that don't, which have seen a 70 to 84% increase in the number of COVID cases. And as we look at Mon County, we know a lot of this spread is related to shared experiences in bars and some restaurants, and as well as people that are interfacing with each other, oftentimes that are younger, that aren't wearing masks, aren't doing the appropriate job in separating, physical distancing, and protecting themselves. And we see that West Virginia is not protected more than Florida or Texas or other states. And ultimately, what we have to do is we have to then work together to reduce the risk that we will start to surge. Because just like we talked about before, if we surge and overwhelm our hospital systems, then that mortality rate goes from 1.5% predictably to 5% or more. And given our population is so vulnerable, we have the potential to go from being one of the best states in the country, where everybody is looking at us in awe and wonder, and how did they do that, to one of the states in the country that joins Florida and Texas and Arizona. And that's something that we don't want and can't let happen to our vulnerable population. Thank you.
Thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As we see the current surge in cases, the governor's tasked us to focus on 4 key areas. One is to continue to work as hard as we can with our state and local partners to increase the amount of testing available. You've heard about testing that will be available this weekend, a significant number of testing lanes across the state. PPE resourcing and production continue to be another priority he has for us. We are already starting to see some issues related to gloves and other things across the United States. The third is data analytics, working with the Hospital Association, other critical service areas to monitor, as Dr. Marsh described, those particular areas related to bed use, ICU room rates, as well as ventilator rates. In addition to that, we will continue to work and focus on stabilizing population efforts, working with VOAD, Food Bank, Senior Services. Just to let folks know, our food banks will be supporting 10 to 12 mobile food banks per week across the various 55 counties. And as the governor pointed out, those who, now that we see a surge in cases, elderly, vulnerable population, and have concerns about moving out in the general population, please use the 211 number and seek assistance through United Way, VOAD, Red Cross, and our other partners who are helping us take care of our vulnerable populations. Thank you.
Thank you, General. Secretary Bill Crouch from the West Virginia DHHR is also joining us today and is available for questions. Now we'll go to questions from media members. The first today is Amanda Barron with WSAZ.
Hi, everybody. Amanda Barron from WSAZ. With the knowledge now that we have the start date for back to school, I wanted to ask, kids almost in September will have been out of school almost as long as a school year. And I want to know what the plans are. And I know it'll be on a county level, but how do we make sure that these kids, kindergartners who didn't learn to read, or students who are so far behind on these skills, how do we get them caught up so they're not a year essentially behind in school?
Great question, and we've got the star of the game show right here with us, and Superintendent Birch, and he'll be able to give you a better answer than I could give you on that. So, Superintendent Birch, if you go from there.
Thank you, Governor. So, Amanda, that's a great question. First and foremost, we have to acknowledge that our teachers throughout the entire spring worked with each and every one of these children during that time that we were off school. So they have a real keen sense of where they ended and what the gaps are. We also know that working with our teachers in our 55 districts, each one of them, as they develop a comprehensive plan that is not only, as the governor stated, going to tackle the health and the safety of our service personnel, our teachers, and our students, as they prepare these plans, that's going to be part of the preparation also. We, first and foremost, will make sure that it is safe, it is healthy. We will support and continue that one caring adult and meet the needs of all of our children, but our teachers are absolutely on point and will be prepared, especially with the time that we have to make sure these preparations are solid, a game plan of how to work with these children that will have that summer loss.
All right, thank you, Amanda. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Governor, you have repeatedly mentioned the legal opinions you're relying on first for the authority to distribute the CARES funding, and also the authority to use a portion of that for highways construction. I've been unable to obtain copies of these legal opinions. So would you make those public for us?
Phil, I think our best person to answer that is our General Counsel, Brian Abraham. But, you're asking a legal question and everything. Brian, I'm sorry? Our General Counsel just told me that they can release them, if I choose to do so or whatever like that. And I want to always be just that. I want to be as transparent as I can possibly be all the time. I don't have anything to hide on anything and everything, so we'll send them to you.
All right, thank you, Phil. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, I've got a question about the grant program that you've talked about for small businesses in West Virginia with 5 to 35 employees. I believe it's $150 million. Number one, is there any thought to reducing that to include all small businesses? We've been reached out to by several who have 3 employees, 4 employees, and they say they're just as much in danger of going under as somebody with 5 employees. And secondly, where are we on the application process with this? When you liken it to Workforce West Virginia and what was going on, when they had snags or delays or problems, you added manpower and technology in order to try to make that go as quickly as possible. I don't know if we're seeing the same level of hustle and urgency in this regard, but as you've said, we've got rough seas out there, and these small businesses are now caught in what you call riptide. And if something isn't done soon, we're going to lose many of them. So is there any thought to maybe responding to this like an insurance company does, going to affected areas, setting up a pop-up tent, having people come and fill out questionnaires and answer questions and cutting a check on the spot? I mean, where is the get up and go on this thing?
Okay, Kenny, in this situation, I'm tickled to death, and this is what I want to be on all situations and everything, and we've been this for the most part, but we're way ahead of you. We have had meeting after meeting after meeting, in regard to trying to find a way to bring everybody, all the small businesses, under the tent. And with that being said, we're right on the cusp, and we'll be doing this on Friday, but we're right on the cusp of announcing how we're going to do this, and we're going to go back to where all the businesses from 1 employee all the way up are going to be able to qualify. And what we've been trying to do is take the dollars we have and fit that into the mold. As I said before, we could have done this in a different way from the businesses up to $10,000. There still may be a way for people to qualify up to $10,000, but what we can do now is we can go back and we can pick up the businesses from 1 employee all the way up through 35 employees. And what we're going to do is start with being able to send out 5,000 to all of those that qualify, and then we will find our sweet spot to the number that have qualified, and then the dollars that are left over from the 150 million, or the possibility of adding more dollars to that as we move forward from the standpoint of the unemployment fund dollars or whatever it may be. But as we move forward, we may add to this 150 million. But what we're going to do is we're going to start back from 1 all the way to 35 instead of from 5 all the way to 35. And we're going to send 5,000 to all those in the beginning, and then the dollars that we have left over from the number of people that qualified and everything, we're going to go back and distribute those dollars equally right across the board. Now, as far as I don't know, was there another part of the question that I may have missed? Oh, how fast that we're sending it out. Kenny, again, what we're trying to do is we're trying to formulate a way that we can defeat the fraud issue. And what from the standpoint, if we don't watch out, we're going to have the same thing that happened with a lot of people trying to apply for unemployment that didn't qualify in any way, and basically were just fraudulently, applying. So we got to really watch and figure out how to do that and everything. So I think Friday we'll hit the ground running and be able to go at that point in time. We absolutely don't want to lose any more businesses in any way. And from the standpoint of those businesses, the federal government came out with the PPP in the beginning, and that was for our small businesses. And I urged everyone to get out, and there's still the ability to apply under that and everything. But from the standpoint of starting to send out dollars and everything, without any question, we've got all hands on deck, and everybody's running to the fire and everything. And we're going to get this done, and we're going to get it done very quickly. I do have to take, exception with, we don't want to do this at the same expediency that most insurance situations are handled. From the standpoint of how most insurance companies handle situations and everything like this, we want to be better than that and everything, even though there are situations where the insurance companies have stepped up and handled things very expediently. But we want to learn from anyone and everyone we can and get stuff out very quickly, and we're going to do that.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I got a couple of questions for Superintendent Birch. First of all, do we have a date at which you guys plan to release the plan for reentering schools in this methodology? And can you tell us at this point, are we looking at a traditional 5-day school week? Are we going to rotate kids? Could you give us a little bit more insight into that, please?
Sure. So the state board is actually meeting today. We have worked with DHHR, Dr. Marsh, WVU, and the governor's office to put together a reentry toolkit. Now, the toolkit is something that the 55 superintendents have been engaged with us on, as well as about 42 state stakeholders. So as the governor said, these superintendents have been putting together these contingency plans. This is actually going to buy us time to make sure they have every need they could possibly have to make sure it's as safe as possible. The goal is, to make it as safe as the governor said, but of course we want our children coming back as normal as possible. Now, that means there may be some modifications to the day, and we're still working through that. But the goal is we want to be able to come prior to September 8th and show that all 55 counties are overly prepared and be able to work hand in hand with the governor and make sure that at that time all 55 counties are ready.
All right, thank you. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. I'm hearing, and seeing social media posts about, employees being fired for trying to help enforce your order. I'm hearing about businesses that are letting people know that, that they're not requiring their employees to follow your order. I guess with that knowledge, I mean, what is going to be the tipping point to try to put something in place to enforce this?
Well, Dave, I want everyone to understand the process. The process is just this. For weeks here, I have urged people in every way to wear their mask. And I've said over and over and over that I did not want to make it mandatory that you wear a mask, because we have some that just absolutely believe that they have a right not to wear a mask. You know, and I know that we're going to, you know, from a standpoint of a level of divisiveness, I know that it's probably not the most popular thing that Jim Justice could do. Now, with that being said, you've got to progress through steps. You see, if 40% of our people were wearing masks and I make it mandatory and that moves us from 45 to 65, or maybe from 60 to 85, and I hope it's more like 60 to 85, then I've made a great big move without telling people that you're going to end up paying a fine, you're going to end up, you know, being charged, whatever it may be. So as I make those moves, if it makes us that level of better, more power to what we've done. But, Dave, if in fact we're getting in situations where employers are doing the wrong thing, we're getting in situations where people are threatening to be fired and all this kind of stuff, then we've got to change that as well. And absolutely what we need to do is continue to go back, as boring as it may seem to you, and watch our numbers. If what I've done works from the standpoint that our numbers start to decline and our daily positives start to decline, then we've won the game. If they don't, and we've got to be more restrictive on the mandatory part with penalties, we'll do it. Absolutely, if they don't, from the standpoint of there are regions like Mon County, and Mon County's got to be treated differently than the other 54 counties, then we have to do that, don't we? We don't want to do that. We don't want to do either one. But absolutely, we didn't sign on that we want to live with a pandemic, did we? But that's what we got. And that's what life has dealt us now. And therefore, we've got to respond, and we've got to deal with it. And that's what we'll do.
All right, thank you, Dave. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Governor, have you talked to the colleges and universities, and will they be sliding their calendar back as well coming up? Because I know a lot of them had been looking perhaps to moving their calendar up so they could let students go prior to the Thanksgiving holiday and not bring them back. What have you been up to?
Paul, we're talking to them nonstop, you know, and I'll let, our Superintendent Bursch speak as well here in just a second, or maybe Dr. Marsh, but we're talking to them nonstop. Paul, the thought process of moving the calendar up in order so they wouldn't have to be, exposed more in the fall when we anticipate that the spike of this was going to come. Just to tell it like it is, whom in Texas felt like this spike was going to come now 30 days ago? Whom in Arizona, whom in Florida or South Carolina, when we really thought that the sun was a tremendous ally to us. And really and truly, we thought that reopening, even though the reopening we were going to ease back into the reopening, we thought that the sun and the reopening and the surge had passed us and everything. Whom in Texas 30 days ago would have really thunk that this absolutely was going to whiplash on us right now? All the people that felt like that really and truly we need to move the calendar up are now probably second guessing maybe the moving the calendar up, that the situation of the spiking is here right now. You got to stay ahead of it. And that's what I'm trying to do. That's what I'm trying to do in West Virginia, and that's what we've already done. I go over and over and over board saying to the people that you, West Virginia, have made the real difference. You've had to make real sacrifice and everything. You've made the real difference. You know that you hear those on the outside that are saying, oh, West Virginia, you're social distance and you're far apart and you don't have the big cities and everything. Well, it doesn't take a big city. All it takes is a significant crowd. It doesn't take a big city. I mean, for crying out loud, if you get together and there's 200 of you together, all of a sudden you have a real problem. It doesn't take a big city. We have done marvelous in West Virginia. And absolutely, we need to continue on that path to continue to do just exactly what I'm saying. And that's what we're going to try to do.
All right, thank you, Paul. We have time for one more. We'll go to David Beard with the Dominion Post.
Hi. The question I'm getting fairly frequently lately regarding the allocation of the CARES Act money deals with the health departments, and they're wondering why a portion wasn't allocated directly to them, where they're on the front lines and struggling to stay afloat. And they just say, for example, maybe a portion of the money that went to the roads could have gone to the health departments, whether that's $1 million to each of the 55 or whatever amount would be appropriate. How do you respond to that?
David, that's not fair. And it's just plain not fair, because the grants that we have, now remember, there's $1 billion that's sitting over there in grants. There was $57 million that's sitting over there that we're still awaiting guidance and all kinds of stuff on. But there is incredible dollars that are sitting over there that the CARES money didn't really need to go towards that. Look, you know, from the standpoint of people having heartburn about us using CARES money to repair our roads, at the end of the day, if we have X number of CARES dollars that are left over and everything, I would a whole heck of a lot rather put that into our roads and send that dollars back. And our experts that are around me are telling me that really and truly, you know, I mean, this has become a hot button and everything. For crying out loud, do you not think that if our experts around me had said, we need $300 million for our cities and our counties, well, then we'd have never brought up the roads. What we did is we went through the math 14,000 different times. And what we came back to is we've got another $100 million over here. And there is a possibility in a way that we could spend that on our roads, or we could just park it. And come December 30th, if you don't use it, you send it back. Well, I sure don't want to send it back. I want to use it. But we've got grants in the grants departments and everything to take care of all of our local health in every way. And you know, that's just not a valid statement.
All right, thank you, David. Governor, I'll turn it back to you.
Well, you know, I promised today that we had a really significant announcement to make in regard to something that was coming to the state of West Virginia. Well, that's something. The two individuals that are right here with us today, one is Joe Balsick and the other one is Bernie Dolan with our SSAC. That announcement was about something that we were doing for kids called Game Changer. They've been kind enough to ask me to be the head coach in this movement that we have going forward. And so, but today, with all that was going on with our schools and everything else, and all that is going on with our climbing of these COVID concerns and everything, it just seemed to me like we needed to table this for today because it is so significant. It is so unbelievable how this movement is going across America. It is so unbelievable that what we've got scheduled is 7 virtual summits that are going to happen right here in West Virginia. It is so unbelievable that what this program is designed to do is help in every way to attack back this terrible opioid abuse, the terrible, terrible situation that's happened to so many of our young people as well as our old. This whole process of game changer that's coming to West Virginia, and I am so proud and so thankful to Joe and to Bernie, to Clayton, to all those that are involved, to absolutely be so proud to be their head coach and say from West Virginia's standpoint, we're all in. And we're going to help our kids. We're going to help all of us in West Virginia in every way. And absolutely, I just think for today, with so much news about so much other stuff, it's probably best to defer this. But that was the announcement that we had. And I want us to know that we'll do this, and we'll do this in a week or so, or maybe 2 weeks when things, I hope and pray, calm down just a little bit on that end. But I thank Joe, I thank Bernie, I thank Clayton, I thank all those that are involved. This is really going to make a big difference, and it is named properly Game Changer. Game Changer. What an incredible name and everything, just for the fact that this is another level of extension of, things that started back with Jim's dream, or things that started back, that were a way for us to fight back against this terrible epidemic that has just stricken West Virginia in so many different ways, as well as our nation, but especially in West Virginia. So we got good stuff coming, and I'm really, really proud of all those that have been involved, and I'm thankful, in every way. So that's it for me today, and keep us in your thoughts and prayers. We're going to have school. We understand the significance of school in every way. We're not going to let our kids get behind, and we're going to do it right, and we're going to do it safe. Anyway, thank you so much.